Hey everyone, welcome to the first of a two-part presentation on the top natural antidepressant remedies. I'm pretty confident that most of us have felt down in the dumps before. Sadness is a normal emotional state of pain characterized by feelings of loss, despair, grief, and disappointment. But these feelings are distinct from depression, which is a mood state characterized primarily by apathy and ahedonia. Sadness is often a component of depression, but you can be sad and still enjoy life. With depression, there's a loss of interest and pleasure from activities that were once enjoyed. People with depression may have wonderful lives. They would even admit that this is true, and yet they still feel horrible. It makes everything less enjoyable, less interesting, and less important. It saps energy and it saps motivation and it saps the ability to experience joy. This isn't to say depression is abnormal. Having a depressed mood is a normal reaction to tragic life events like losing a loved one, but only when temporary. If depression persists for weeks, then it's considered a clinical mood disorder, which are psychiatric conditions that cause notable distress in your daily life or impair your ability to function. And believe it or not, depression is by far the most common psychiatric condition in the world, afflicting roughly 1 in 4 adults. It's also one of the most impactful, coming in as the second leading cause of disability in young and middle-aged adults, second only to low back and neck pain. While there are a variety of antidepressant medications available, these often come with a host of nasty side effects that can actually contribute to worse depression by virtue of how they affect your life. In this presentation, we're going to discuss some of the far more safe and effective natural remedies to lift your spirit and restore your hope. And to start off our list, we need to look at our lifestyle. While modernity has blessed us with numerous technological and medical advances, it has also led to a range of lifestyle issues that take a toll on our mental health. People today are more sedentary, chronically stressed, spend more time indoors, and don't sleep well. All of these factors have been linked to depression and deserve first-line consideration for improving psychological health and mental well-being. So that's what we're going to focus on first. The 4 pillars of lifestyle for good mental health: regular sun exposure, quality sleep, exercise, and stress management. First and foremost, if you are looking for a supplement to help with depression, then you should start your shopping outside under the sun. Through impacting our circadian rhythms and blasting our body with bioactive light, sunlight is truly medicinal when it comes to mental health and especially depression. Throughout evolutionary history, we awoke to the sun. Depending on the season, we may have gotten up a little before or after sunrise, but the sun was pretty much always there to brighten up our days. Yet modernity has made us transition from a people of the sun to a people of the cubicle. And if we would simply add some natural light back into people's lives, maybe this pandemic of depression wouldn't exist. Consider this. Simply working in an office building with windows increases physical and mental health, vitality, and sleep quality compared to working in a windowless prison. And this isn't the only study showing benefits. Several other interventions that increase the amount of natural sunlight into people's lives have shown that it improves mood and reduces stress. Hell, even using artificial lighting that is designed to mimic an open blue sky on a sunny day leads to improvements. A notably higher sense of connectedness to nature, higher parasympathetic tone, which is helpful for rest and regeneration, lower sympathetic tone, which is your stress response, similar work performance with a lower perceived effort, and greater melatonin secretion later on at night. Outside of general mood, sunlight is critical for the prevention of depression in those with mental health disorders. Many depressive bouts are related to changes in seasonality. Roughly 1 in 4 people with bipolar disorder have seasonal depression that is worse in the winter. And even people with chronic depression throughout the year experience a bump in their symptoms during the winter. This type of seasonal depression is called seasonal affective disorder, or SAD for short. It's believed to come about from changes in brain chemistry that result from a lack of sunlight. At a population level, clinical and subclinical SAD affects roughly 1 in 5 people living at latitudes around New York, but only 4 in 100 people living in sunny Florida. And that's a huge problem because depression, whether intermittent or chronic, can be a tremendous risk to the individual due to its perpetuation of suicidal thoughts. In non-equatorial countries, Google searches for depression peak in the winter, and suicide rates are highest around the end of winter and beginning of spring. But in both cases, these patterns are not observed in areas around the equator where the sun is always shining. Unsurprisingly, SAD is treated by mimicking the sun. It's literally the condition that launched the entire bright light box industry, since hitting yourself with at least 10,000 lux of white light in the morning is an established way to prevent the development of SAD. But even in chronic non-seasonal depression, meta-analyses have shown that bright light therapy reliably improves depressive symptoms. And that's just bright light. The sun also puts out UV radiation that itself has been shown to have antidepressant effects, likely through stimulating vitamin D synthesis. Several studies have reported that vitamin D deficiency is related to more severe depression in those with clinical depression, particularly an inability to feel pleasure, and a meta-analysis of interventions reported that vitamin D supplementation significantly improved depressive symptoms. Sunlight is likely to accomplish the same thing. Plus, in both humans and animal models, depression is linked to mitochondrial deficits and inflammation within the brain that can be resolved with the use of infrared light therapy. At least one pilot study has shown that hitting the forehead with infrared light puts some individuals' depression into remission, with an overall reduction in depressive symptoms of 54%. And guess what the largest natural source of infrared radiation is? Yep, sunlight. About 30% of the light put out by the sun is infrared radiation. Through facilitating changes in brain chemistry and function, sunlight directly battles depression. So the key point here is that regular sun exposure can be considered central to the treatment of depression through synthesizing vitamin D, providing an ambient source of bright light, and correcting brain deficits in mitochondrial function with infrared light. Coming off the heels of getting ample sun exposure during the day, we need to talk about getting ample quality sleep during the night, our second lifestyle pillar for good mental health. The American Academy of Sleep Medicine and the Sleep Research Society agree that getting too little sleep is really bad for health. They agree that getting less than 7 to 8 hours of sleep per night is linked to worse cardiovascular health, metabolic health, mental health, immune function, physical performance, pain, and even a greater risk of dying. Roughly 3 out of 4 adults with depression have symptoms of insomnia and sleep disturbances that are a predictor for one's treatment success, including the risk of relapse and depressive recurrence. In a meta-analysis of 21 studies, individuals with insomnia had a 2 to 3.5-fold greater risk of developing depression. The sleep depression cycle is rather straightforward and self-perpetuating. Poor sleep quality causes fatigue and difficulty coping with daily life, which can reduce self-esteem and increase feelings of worry and stress in susceptible individuals, which can feed back into reducing sleep quality, and then the cycle repeats. While there are many aspects of getting a good night's rest, the most important is minimizing artificial light at night. Blue and green light tell the body that it's daytime, so exposure to artificial lighting at night absolutely wrecks our circadian system. Thankfully, the solution is relatively simple. Block it. Wearing amber glasses has been shown to help maintain sleep quality in people exposed to light at night. It's even been shown to help insomniacs sleep. Could you imagine having insomnia and experiencing a 16 to 20% improvement in sleep quality, distress caused from poor sleep, and quality of life from just wearing some goggles for 2 hours before bed? That's pretty impressive. In a particularly relevant study, had college students play on their smartphone for an hour while lying in bed before going to sleep, and they fell asleep roughly 25% faster when they wore amber glasses that filtered out most of the blue light, compared to when they didn't wear any light filtering glasses at all. The mental health and sleep benefits of minimizing artificial light at night have such a strong foundation of evidence that there is currently an intervention being conducted in hospitalized psychiatric patients looking at the health effects of eliminating blue light from the psych ward lighting system between 6:30 p.m. and 7 a.m. So the key point here is that getting a good night's rest is a critical component of mental health. There's a clear link between poor quality sleep and the risk of depression. So focusing on optimizing sleep hygiene should be prioritized. One of the easiest ways to do this is to simply block out artificial light at night, which inappropriately signals daytime to the brain. By the way, everyone, if you're enjoying this content and you want to have all this information at your fingertips, then head over to theenergyblueprint.com/antidepressant-ebook and grab our free ebook. All right, so our third lifestyle pillar for good mental health is exercise. Generally speaking, the health consequences of sedentariness and the health benefits of exercise need no introduction. Suffice to say, they play out when it comes to mental health too. Dedicated exercise and being more leisurely active interacts with our brains in numerous ways to help balance mood and make us feel good. It reduces neuroinflammation and oxidative stress. It increases brain-derived neurotrophic factor. It enhances neurogenesis. It increases serotonin signaling. It increases beta endorphins. It balances the neuroendocrine axis and normalizes cortisol. Aside from exercise providing marked beneficial effects on neuroendocrine systems, it also increases self-efficacy and self-esteem via activity scheduling and attainment of goals, which are important psychological issues among people who are depressed. From a practical standpoint, at least 8 separate meta-analyses of randomized controlled trials have reported that both aerobic and resistance exercise effectively reduce depression in children, adults, and older adults. For example, the most recent meta-analysis looking at aerobic exercise exclusively, which involved 11 randomized controlled trials, found that just 45 minutes of exercise 3 days per week substantially reduces depression after 2 to 3 months. In fact, the effect of exercise was superior to that of antidepressant drugs and psychological counseling. As another example, the most recent meta-analysis looking at resistance training exclusively, which involved 33 randomized controlled trials, found that regular exercise training reduced depressive symptoms regardless of the total training volume, that one person would benefit for every 4 that participated, and that you were more likely to benefit the more depressed you were to begin with. And if you simply don't want to do any type of formal exercise, then don't worry, we have plenty of evidence indicating that even low levels of regular and consistent activity, like going for a walk or gardening, can help raise your spirits and prevent depression. So the key points that exercise, whether it be aerobic exercise or resistance training, is one of the best things you can do for your brain and mood state, being even more effective than antidepressant drugs and psychological therapies, according to some studies. All right, so our fourth and final pillar of mental health is stress management. We all get stressed out in life, right? It's a normal part of existing, but chronic stress is an artifact of modernity. From an evolutionary perspective, chronic stress did not exist. If you were being chased by a lion, you either died or you survived, and the stress response came and went. Today, we get stressed by countless artifacts of the modern world, like work overload, financial troubles, and social embarrassment. And they're always there. They never disappear. And this chronic stress seriously messes with our mental well-being, to the extent that some researchers have proposed certain subtypes of depression be called stress-induced depression. This was evident when researchers from King College London followed over 1,000 individuals from the time they were 3 years old up until they were 26. Greater stress throughout childhood and young adult life was significantly associated with a greater likelihood of experiencing depression. One reason for the stress-depression link is due to how stress affects neurotransmitter signaling in the brain, particularly that of serotonin. And serotonin is a tiny molecule with a big job, regulating brain development and function, sleep, appetite, mood, memory, aggression, and digestion. It's been implicated in practically every type of behavior. Normal temporary stress causes an increase in serotonin levels that help us cope with the event. It's a form of adaptation, right? Chronic stress completely screws up this symptom. With serotonin, the receptors that it needs to bind with in order to have an effect start to take a break from work, with less and less showing up when serotonin calls because that serotonin is always present. The result is that less serotonin is able to transmit its signal, regardless of how much you have. Another way to look at this is that serotonin is the worker and its receptor is the machine needed to work. You could have hundreds of workers show up at the factory, but that doesn't matter if you only have 10 machines that are available to work with. 90 of the workers may as well not even be there. These concepts are easily illustrated in a study by researchers from Weizmann Institute of Science in Israel, who looked at how much serotonin was taken up by cells in response to an infusion of cortisol in both healthy folk and people under chronic stress. The normal increase in serotonin uptake caused by cortisol was completely abolished in people under chronic stress. What all this means is that being chronically stressed will leave your body and brain deprived of serotonin due to its natural response of downregulating serotonin receptors to prevent overstimulation. And it's not just serotonin that's affected. People who report higher levels of burnout at work have a 15 to 25% lower concentrations of several neurotransmitters compared to their less stressed peers. Thankfully, stress reduction techniques like mindfulness meditation are incredibly effective at treating depression. Meditation isn't mainstream and probably conjures up images of Buddhist monks for most people, but it serves as a good opportunity to mindfully introspect about what troubles us and helps work us through our stress. A huge analysis of 47 studies with over 3,500 people clearly showed that mindfulness meditation programs reduce levels of anxiety, depression, pain, and stress while increasing mental health related quality of life. These benefits were seen in as little as 3 to 4 one-hour sessions over 8 weeks. Mindfulness may even be able to replace pharmaceutical antidepressants. The PREVENT trial showed that over a 2-year period, mindfulness cognitive behavioral therapy led to similar rates of relapse and remission as standard drug therapies in those with depression. It makes sense, really. If you have unproductive worries, you can train yourself to experience those thoughts differently. Mindfulness meditation teaches you to recognize your stressful thoughts and reframe them in a positive manner. So the key point here is that chronic stress drains the brain of neurotransmitters, particularly serotonin, and it predisposes us to depression. Engaging in healthy stress management techniques like mindfulness meditation can go a long way towards improving mental health, possibly rivaling the effects of antidepressants. And that's it, everyone. The 4 lifestyle pillars of good mental health: regular sun exposure, quality sleep, exercise, and stress management. If you want to learn more about these interventions, as well as a ton of information on natural antidepressant supplements, then head over to theenergyblueprint.com/antidepressant-ebook and grab our free ebook. And lastly, I do want to briefly mention that if you're interested in managing your depression and taking your cognition to the next level with some of the most effective supplements out there, then you should check out UltraBrain. While it obviously won't provide you with the sun, sleep, exercise, and stress management that we talked about in this presentation, it will supply you with some of the most potent antidepressant supplements out there, which we'll be covering in part 2 of this presentation. And you can grab some at theenergyblueprint.com/ultrabrain. Seriously, just look at what people are saying. Jason, I've tried numerous nootropics and UltraBrain is the best by far. Maureen noticed effects in just 4 days with just a partial dose. Tim is loving the product and says it's much better than Qualia. Beth really loves UltraBrain and is reducing her anxiety and depression after just 1 week. Getty feels and even looks more clear and less tired. So again, if you want to get your bottle, just head to theenergyblueprint.com/ultrabrain.